was 1996 when the World Health Organization Ad Hoc Committee on Health Research and Development Priorities identified a pressing need in global well-being to strengthen health services and systems research in low and middle-income countries. 20 years later, that aspiration has come of age. In 1997, during the international consultation at Lejondal in Sweden, a group of public health experts officially recommended the establishment of an Alliance for Health Policy and Systems Research. These seeds planted in Lejondal took root in 1999 with the formal constitution of the Alliance for Health Policy and Systems Research. Since the turn of the century, the landscape has evolved significantly. There is more interest, there are more players, and more beneficiaries. The Alliance has, of course, been at the center of this development. Those early seeds have flourished and be shaped and managed as the Alliance itself adapts and learns. And we are ready to take it further yet.
Come with us now as we tell the story of how this idea first came about and how it has blossomed into the successful partnership it now is. In 1999, after the Lejondal meeting, the creation, structure and plan of action of the Alliance for Health Policy and Systems Research, an initiative of the Global Forum for Health Research, was endorsed at a meeting of interested parties. Then, in March 2000, came the formal launch of the Alliance, hosted by the World Health Organization.
I was at that original meeting at Lejondal 20 years ago. I then took on the role of board chair, so had the task for the next 10 years of overseeing its growth and development. So it's interesting to reflect on what the field was like 20 years ago. I think it was pretty clear there was need for a global advocate for health policy and systems research that would help make the case for the value of that research. There was need for greatly enhanced funding, which the Alliance should stimulate. And then there was need for much greater capacity development of researchers in lower middle income countries. And again, that was an important objective for the Alliance to stimulate the development of that capacity.
The mission of the Alliance is to promote the generation and use of health policy and systems research to strengthen the health systems of low and middle income countries. The work undertaken in those early years became the foundation of the Alliance and of the field of health policy and systems research. Through initiatives such as development grants, the Alliance began to spark an interest among young researchers, opening up opportunities for them, often for the first time, to engage in health policy and systems research.
Why I will remember the relationship with the Alliance is because of their focus on young researchers. When I got my first opportunity to work with the Alliance, I was also a young researcher looking to establish a future in health systems research. And the Alliance was, of course, a pioneer in this domain. They supported at a very crucial point of my PhD work in public health. And that project flourished into an amazing experience working with several local policymakers, with other access to medicines researchers in my state in southern India.
The support I've received from the Alliance has been incredibly important in helping my thinking on health policy and systems evolve. One area that I've been able to develop significantly is understandings of governance and accountability in health systems. Some of the issues of the software of the health system, the relationships and trust, how people relate to their government, the contextual issues of caste and class and gender have been underexplored in governance, and we've had the opportunity through our work to really look at how these issues of context and software influence people's engagement with their health system.
Through important work such as the flagship report, Strengthening Health Systems, the Role and Promise of Policy and Systems Research, the idea that research needed to become an integral part of national health systems development was planted. The Alliance continued to thrive and evolve, and in 2004, Its existence was further strengthened when global leaders at the inaugural Ministerial Summit in Mexico called for greater investment in health policy and systems research. This call was again reiterated in 2008 at the Ministerial Summit in Bamako in Mali. This brought about more funding, enabling the Alliance to flourish and to define its niche within the health policy and systems research community.
It may come as a surprise to some people, but our biggest challenge is not the lack of financial resources. It is the lack of engagement with partners and funders necessary to enable the optimal use of resources that are available. In terms of actual dollars, the financial contributions from the Alliance to Pakistan have been relatively modest. However, if we look at the impact that has been achieved with that modest investment, it's quite impressive. It is the engagement that comes with the funding that has brought the most value to our work.
Breaking down barriers that obstruct the goal of health systems performance and the proportionate distribution of health lies at the very heart of the Alliance's approach. Health systems need to be understood as a system of interacting parts. In 2009, the Alliance published what would become an influential guide in the field, a flagship report on systems thinking, which encouraged a much more integrated approach to working that had been missing in many countries. Another major turning point came in 2012 with the release of the World Health Organization's Strategy on Health Policy and Systems Research, Changing Mindsets. This was followed by the World Health Report 2013, Research for Universal Health Coverage, both of which recommended the embedding of health policy and systems research in policy and decision-making processes. In leading the implementation of these strategies, the Alliance really stayed true to the principle of engaging with policymakers and involving them not only as beneficiaries of research evidence, but as true partners in the development of this field.
If you look at what is coming out of the Alliance, you will see the perspectives of policy and decision makers. This is evident not only in the publications, but also in the way the Alliance programs have been designed. We can also see this in the discussions that are currently taking place globally, not only of policy makers, but also as part of the community. And it's because I believe in the value of the work of the Alliance. I have, for that reason, made a commitment in 2015 to provide financial support through our Medical Research Council. Support that I believe is important to South Africa, but also is important for low and middle income countries as South Africa.
The Alliance's achievements have undoubtedly strengthened health systems in lower and middle income countries, and it has supported the achievements of the Millennium Development Goals. A systems thinking approach becomes even more crucial as the world begins working towards the Sustainable Development Goals.
The Alliance has not only helped to raise the profile of the field and demonstrated its relevance to the Sustainable Development Goals and to UHC, it has played a critical role in its evolution and in shaping new thinking. 20 years ago, there wasn't much talk of systems or systems research. But today we are talking about systems thinking, and we are talking about things such as embedded research and co-creation of knowledge. I think that the Alliance deserves credit for that.
Together, the efforts of this partnership are paying off. So what now for the Alliance as it journeys into the future?
I would love to be able to predict the next big leap, but let me propose a couple that I think are possible. One is a leap in expectations and practice, that people will expect and governments will use evidence to inform policy and programs. This means that health policy and systems research will be the new norm for guiding health policy and programs. I think that this will move us a long way along the critical pathway to having responsive and effective health systems. Partly it's, the Alliance's work in systems thinking and complexity, its ability to bridge communities and have collaborative approaches, putting equity at the center of its work. This is really critical to this kind of problem solving.
Looking to the future, I think that there are a lot of opportunities and also challenges that the field faces. The field has matured, I believe, with the help of the Alliance. And the field is, as I am, ready to face these challenges. The world is changing, but one of the most valuable offerings I think that health policy and systems research gives us is its orientation around how we view problems. So having a more problem-based approach. What I see for the future of the field is one where it grows because the passion and the drive emerge from countries themselves.
The seeds have borne fruit. The world is watching, waiting, and our alliance is ready. Now it is up to us to ensure that the promise inherent in health policy and systems research is realized again and again.